Hey, Dr. Anita Haque Parker here. I'm so excited because we are going to talk a little bit about helping your patients with a main problem that I get a lot in my practice, which is like shoulder, collarbone. So today, by request, I'm going to share with you how I adjust and help my patients who might have sternal, collarbone, or AC joint problems. So we're going to focus on the collarbone. I have my amazing patient here ready to go. And that way we can zoom in on what's happening here. So as I bring this forward, I'm going to show you a little bit about how I contact the collarbone and how you might want to help your patient with that. So here's the collarbone right here. And what you want to do, if you want to check if there's a problem for having any pain in the collarbone, sometimes why I would do this adjustment in particular is because I've had people say to me, hey doc, I don't know what's going on, my chest isn't moving right, I'm feeling something weird from my shoulder. So that's what's led me to see that collarbone subluxations do occur, not often, but it can happen with somebody who may have had an old rotator cuff, old AC joint, or if they're athletic, like this individual here, and lift a lot of weights and maybe press heavy weights, they can also get some rib issues and collarbone issues. So here's how you want to palpate it. You want to make sure you're making it as comfortable for your patient as possible, because we all know it's sensitive there. So you want to be mindful of that for your patient. So I would just take my hands and take the palm of my hand. I always like using the fleshy area of my hand to palpate my patients to make it more comfortable for them. And then what you're going to do is just with a little bit of a rocking motion, just like you would with motion palpation, you're just checking to see if there's movement, okay, on both sides. Again, I can do a hand cross, do this side, check. I'm kind of checking the difference between this collarbone rocking and oscillating versus the other side. And it feels like it's a little stuck, and we'll go ahead and adjust his right collarbone so you guys can see this. The way that I like to do it is one of two ways. So one thing you can do to make it really, really gentle, especially if you're doing this for the first time on a patient who might be nervous or timid, you'd have the patient turn their face away from the collarbone that you're adjusting. So I'll have Don will turn his head to the left, perfect. Then I'll take my hand, and what I'm going to do is use the fingers on my opposite hand. So I'm using my left hand here. I'm going to tissue traction that collarbone this way, if you can see that. Then I'm going to take the other hand, which is my right hand, in a pounding formation on the palm, like making a fist like this. I'm going to go ahead and just, like as if I'm kind of hammering a little bit in. It seems like a little weird adjustment. It looks like it's harsh, but not at all. And you can go along the ridge of the collarbone. What makes this gentle on the patient is that you're only pounding on top of your fingers. So they're gonna get that force coming through as you continue forward. So that's one way to do it. A second way is if you're feeling like it's not really adjusting and you wanna take it to the next level and you feel skilled enough, similar to my shoulder adjustment, and you can always reference that in another video, is you would take the arm out just like this. And what I like to do is I pull and traction, just like I would with a shoulder, I would do it this way, but I'd actually pull and traction a little bit if I put my hand on the collarbone. And I'm using the palm of my hand like this. Gonna go on top of the collarbone. Don, go ahead and turn your head to the left. And when he does that, then I'm just lightly dropping my weight here. So that's another or second way to do it. So I'm holding this and tractioning the shoulder. I'm holding the arm and tractioning the shoulder as I'm pushing a little bit lightly, oscillating with that collarbone to get that adjustment, okay? Now, if that doesn't work, here's a third method. Of course, you can also use the activator and just activate that collarbone and use that technique as a fourth method. But as a third method in terms of diversify, what you could do is do a cross pisiform. So this left palm of mine would be on Don's sternum, on the middle of the sternum, just to add that support. And then the other hand, again, using that fleshy part of my palm, the thenar pad, I'll go on top of the collarbone. Then Don, I'll have you turn your head again to the left. And then as he does that, I'll just push down just a little. And we just felt a little pop right there. Does that feel okay? Mm-hmm. So it's very, very, very gentle, really, really small movements, but it will make a difference. Let me show you just a little bit on the opposite side here. So again, my last technique, so I'll have you put your head straight. You can do that double pisiform method, and you just push here. Why do I have the patient turn their head away? A lot of times I just find that their face is too close, they get nervous, they get tense. Having them turn their head away also, I found, helps with the tissue traction in that area for the collarbone, which will elicit a better adjustment, okay? So on this side again, turn your head to the right. So we're gonna do his left collarbone here. Hand on the sternum, opposite hand, or pisiform or fleshy part on the collarbone, and then I'll just push through and make sure we're getting movement. I hope this video helps you. Make sure you take good care of your patients, and I'll be back again with another tip for you.